This is the Clinical Consultation Network. We do this usually every Tuesday at 12:30 p.m. Central Time. But given the circumstances we're facing, this thing you may have heard of, the coronavirus, we have decided to add some more sessions, more broadcasts to try and make sure that people are very well informed, that we're trying to, get all the information out here that we can. To have a little bit of a discussion about it, because I know there's a lot of stuff swirling around out there, a lot of different pieces of guidance that really, I'll tell you, I've had a hard time myself even sorting through all of the different things that we're discussing. And so there are a lot of things moving right now, and I just want to make sure that our audience is well up to date on everything that's going on, and that we're getting ourselves prepared. This is not the ideal circumstance. I don't think anybody is enjoying this isolation that we're having to do, and these different things that we're having to do. There are things we're doing for one another, though, that are very, very important, and we just want to continue to emphasize those. And I think back to, a lot of people have been using the analogy of war with this, that like we're at war right now. And I think that was a reasonable analogy, because I think back to during World War II, when London was facing bombings every day for, I think, about 2 months. These bombings that were occurring every day that they had to deal with. And Winston Churchill had to continue to help people be, kind of buck up under those circumstances and deal with it. And so I think that we're kind of in a similar situation. We're going to be at this for a little while, and we're going to have to figure out, how we deal with lots of different circumstances, and to really strengthen ourselves to get through this. I do think we can do it. I think it's doable for us. So this is part and parcel of the reason that we want to meet with you regularly, and just to try to make sure we're addressing things in real time that are important to you. So, of course, today I have our primary guest is not really a guest, he's a co-host, David Tickler, who's our Director of Nursing. And David has put together some guidance on what to do in a circumstance where you may need to provide services to someone who has tested positive for the coronavirus. Now, of course, one difference I want to point out here is there are a lot of people for whom the coronavirus might be suspected. In those circumstances, we're going to be in touch with the primary care physician, but we're talking about here, we want to differentiate and understand differences between people who might be suspected of having coronavirus versus those who actually have been tested and determined to have coronavirus. And so, there are some differential things that we need to think about there. So, David, with that intro, I'll invite you to come in and maybe just get started here with some of the information that you have. And what I would like to do periodically throughout your presentation is not only provide some of my own guidance about how to implement these things with people with intellectual and developmental disabilities, but also to have our audience come in and maybe contribute anything that they may have or any thoughts that they may have for facilitating some of these things that we're talking about. So, David, with that, I'll turn it over to you.
Thanks, Dr. Davis. I appreciate that. And that's exactly what I was kind of hoping today, because the material that I have here is just a lot of the same material that everyone has received. This is a specific guidance from CDC regarding taking care of somebody that is positive or thought to be positive. And so it's not going to be anything new, but it's going to just review kind of what's important and what we need to look at. One of the first things that I just popped into my head on this is how it spreads. And this is the exact reason why we're so adamant about staying home and maintaining that social distance from one another, because there is no vaccine. And the best way to prevent this illness is to not get it and not be exposed. So everybody just keep that in mind. It transfers through respiratory droplets, and they can land on you, and they can, as they're, like you said, as things are changing, we're learning that they can stay in the air and stay on surfaces for extended periods, and that's why it's really important to maintain cleaning practices and such.
Well, David, I'm glad you led with that point, because I do think that it becomes more complicated at the point that someone contracts the COVID-19 virus. And so if we're able, everything that we're talking about to prevent that is that it just underscores the importance of that, because the job does become a bit more complicated at the point that a person actually has it. So everything that we're doing to prevent is very key, and preventing it from spreading. You mentioned some of those guidelines, and at first I think people were talking about a 3 foot distance, but now I think the guidance has been upgraded to try to maintain a 6 foot distance.
And a good example of that, to measure that, they said about arm length is about 3 feet. So if you stick both your arms out, so keep your distance from both arms length from other people around you. And that was a good way to measure, I thought.
That's a great way to measure that. I was trying to think of what are some visual ways you could come up with to do that. I hadn't thought of that one. That makes perfect sense that you would use that, and I think that may help a lot of people with IDD in kind of visualizing what that means. Michelle says length of a car, maybe more like the width of a car, right?
I figure if you stay a car length away from everybody, that's more than 6 feet.
Okay, so you're going for very long distance there. I got you.
Oh, that's good. Well, the first comment that the CDC said was to stay at home except to get medical care. And most people, as you've heard over the news, most people that get the symptoms or hopefully will just have mild symptoms, and they'll probably be able to recover at home. But be sure to call your practitioner before you charge into their office. They may want to treat you through telehealth there at home. And so just stay in touch with your doctor and avoid transportation, public transportation.
Yeah, and at the base of it, that's a good recommendation for everybody, is just to stay home, whether you're sick or not at this point, if you can. I mean, obviously, I don't want to make it an impossible scenario, but to the maximum extent possible, that should be what everyone is doing at this point, not just those who are sick, but particularly those who are sick.
So then this goes on next to talk about separating yourself from other people in the home. Kind of isolate and quarantine, not per se, I guess it's not true quarantine, but you want to try to isolate away from other people, because you don't want to give it to anybody that doesn't have it. So if there's a separate bedroom that you can stay in, and that will help, and limit your contact with other people and with pets and animals. The CDC guidance for that actually had a couple of paragraphs on there speaking about the pets and animals, but I didn't put that in there. I figured it was more appropriate just to say limit your contact with your pets and animals too. Here again, just like we mentioned earlier, when staying at home, call ahead before you visit your doctor.
Yeah, this could be something right here that would be particularly difficult with a lot of people with IDD, and there may be, for some people, a difficulty being so far away from others. I mean, there may be a comfort or something that they have with being close to people, and it may be something that's difficult to adapt to. Looking for alternative ways of interacting with people under these circumstances might be really important. And being able to, I've noticed that, like, when they do interviews on television now, you see the people seated in different, further away from one another. But as you're doing some of the things you would typically do, maybe typical games or other things that you would play like that you come up with ways to do that at a distance, and to give people attention at a distance. And this is going to be kind of an adaptation maybe from where we have been in the past, but it is certainly something that is going to be important to try to adapt to do.
Absolutely. That would be kind of hard to be secluded in your room for some of the people we support. Likewise, it may be hard for someone who we support to wear a face mask. If you're sick and you're around others, it would be ideal if you were able to wear a face mask to just help prevent spread of germs from yourself.
Yeah,
Suggestions on that, Dr. Davis?
well, here I do have a couple suggestions. And one thing that we know is that these masks are actually pretty hard to come by these days. And I will attest, I went to my Walgreens just to see what the availability of them is, and that section of the store is completely sold out. There's nothing there. I actually, just to kind of test whether or not you could get things, tried to order some things on Amazon and found that I believe that order is going to be delayed because of, and I didn't order a great quantity, and I certainly would have donated them to someone else who really needed them under the circumstance. But just knowing that there's very little availability of this, I have heard about people making masks, and that, this is kind of an adaptation. Yeah.
Sorry. I wanted to just interject something right there. I found online a way to make a mask that is acceptable by I think the CDC has allowed these cloth masks to be made to be used when we have nothing else to use. They say that they're not quite as good as the N95 masks, but they were tested as effective, and it's just cotton material. If you had nothing else, you could actually use a cotton shirt and tie it around or anything. But there is a pattern that you can use, and I will send that out to you, David, if you want that. Okay. So
I'd love.
It's important for us to, we don't want to take away from the frontline healthcare providers by buying up masks or anything like that. But if we can make a mask that's pretty effective, I think that's important to know, and we can make some and not be taking away from the frontline healthcare, and that's important.
Yes, I agree, and I've seen several recipes for this, and I know that I said recipes. Manners of making these masks. The only cautionary note, and so they're most valuable for the person who is sick in these circumstances. And so, the point I would want to make about people with disabilities here is that they may not be that accustomed to wearing something like that or understanding the purpose always of wearing something like that. And so what might be important is to have some practice sessions before, at a point where a person's not sick, just to get used to what it is that they're wearing, kind of get them desensitized to it so that if that eventuality came about, that they would be prepared for that.
Well, there's also an option of involving them in the making of it if you're going to get material.
Absolutely.
And the color they want, maybe a pattern they want.
I was thinking about, I went today I had a doctor's appointment. I'm not sick, but I did have a doctor's appointment today, and I stopped by Walmart, and they have the cutest, materials that I think would be important for people to be able to pick something. If they got involved in that, it would be helpful.
Yeah, I think it's a great way to involve the person supported. I'll tell you, and I heard from a friend of mine, Katie Powers, who is the assistant director, I think, at Developmental Services of Dixon County, and she actually had her staff working on these masks together, masks that they might wear as staff members as well. And, it was kind of what I liked about it was that this was kind of a good project for the staff to work on in getting prepared too, and good morale builder. And so I highly recommend to work on this in a situation where we're facing these circumstances without the typical equipment that you might expect. And that
camaraderie.
I certainly felt, when I found that, you know, you could make them, I mean, I started thinking about, you know, making a few this weekend.
Yeah.
And it makes me feel better. I know there's probably not much we can do, but you know, if you're busy doing something that could help a little, I think that you feel better.
Yeah, Candy, I think it is so important what you're talking about. And, you know, for those who aren't in a situation where they might need a mask, I mean, anybody is, really. You know, we're all potentially someone who might be infected, but to make a few extras and to donate them to somebody who might be able to use them.
Yes, there was a hospital in Illinois who was asking for people to make the masks, and they showed how to make them. I'm going to make mine a little different than they did, but they showed how to make them, and they were asking people to drop them off, and then they laundered them, and we're going to be using them actually in their hospital, you know. And because we're in a pandemic and we don't have enough materials, the CDC has okayed these masks. And I would say they're, you know, the studies are showing that they're very close to the N95.
Yeah. Well, that's fantastic. And if you'll share that, what you have with me, I'll put, you know, I'll share that with others on the call too.
Great. Thank you.
So this is a time for adaptation, a time for people to get creative and to make things work. Certainly, if you create one of these masks, you want to make sure that it's something that's breathable. You know, test it out, make sure it works well, and doesn't cause any problems, because I do know there are a lot of different styles of doing these that are out there. So, okay, David, we had a lot of conversation on that one. Thank you, Sandy, for those wonderful contributions there. And, you know, I hope others as we go through will do that. And I see we're getting a lot of comments. Michelle, are you
There's a lot of stuff in the chat box, and I was going to say, anybody that's on their computers, y'all put up your chat box so you can see what people are commenting on. There's just a tremendous amount of comments people have.
I'm following it there. I mean, most of it's sharing recipes for hand sanitizer, talking about masks, some locations where you may be able to get masks. That's the majority of what's happening.
Okay, that's good. I was going to ask if anybody knew about particular places where you might be able to obtain the commercially produced equipment.
Yeah, Home Depot or Lowe's is one thing that someone put in there. There were some at the Dollar Tree. But again, this is going to be limited to their availability. So.
Yeah. Somebody ordering from Amazon today, so they're doing okay with that.
Well, I think the stores will slowly get restocked, and we'll slowly see that come back on the supplies level.
Yeah, I think they're working at getting more produced. And when I say they, I think several companies have been motivated to increase production and get those out.
So if the person you're supporting isn't able to wear a mask, then you know we want to try to encourage them to cough to cover when they cough and sneeze, and then throw that tissue away, clean their hands, or help them clean their hands. Washing their hands is the best. Yeah,
that. You know, David, that occurs to me, that may underscore a reason that you need to produce, if you're going to have, you know, when you have masks, to produce more than just one, because if somebody were to sneeze in a mask or to, you know, use it for an extended period of time, there'd be a need to switch out and get another one. So, you certainly, I think, would want to have more than one option available to you in that circumstance.
The good thing too about those masks, I want to say one more thing, sorry, is that they can be washed and sanitized and reused, and that's important too.
Very good.
Well, we'll just move on here, and like I said, this is just a topic that you can't really press too much right now, but keeping your hands clean. That is really the most important thing. And anything that you touch could be contaminated. So just keep that in mind and try to avoid touching your face at all when you haven't sanitized your hands or washed your hands. And soap and water, hand sanitizer, whatever you have available. If you don't have any soap or water or hand sanitizer, water is still helpful. So just keep in mind that you need to clean your hands as much as possible.
And, I have noticed, I could be wrong, and I'm going to go back and review the video of this session versus the session we had on Tuesday where I was touching my face constantly, I felt like, throughout the broadcast. Today, I think I've done a much better job with that, but I'm going to measure that. I'm going to watch the video of myself and see if I really did that. And look, this is just ways of entertaining ourselves while we're bored. Okay, maybe you can try that with some of the people you support. Let's just take a video of ourselves when we don't know anybody's looking, or have somebody else take a video of us while we're long enough that we can forget about it, and see how many times we touch our face during that period. Now, if you watch that video, I think what happened to me is when I became conscious of that on Tuesday, that I am doing that a lot less now, and that I'm developing the habit of not doing that as frequently as I have in the past. So, just bringing attention to it can be something that is really, really helpful.
Absolutely. Another tip would be to avoid sharing personal household items, dishes, drinking glasses, eating utensils, cups, towels, bedding. Just be mindful of that it can be spread through those items also, and try not to be sharing of them. Make sure they're clean.
So David, this is one curiosity I had, and we may have to get more information on this, but so if the items are properly washed, so and by saying properly, I'm basically saying, did you run it through the dishwasher or whatever? Are we saying that you shouldn't share items that have been washed, or are we saying that you could, once they've been washed, they could be shared? We're talking about not sharing.
Right. I think once it's been washed, it's fine. But certainly not sharing anything while it's being used by someone that is positive or thought to be positive. We're fortunate with the virus in that it seems to be fairly. It can be cleaned with all pretty much the standard cleaning products that we have. So that is one real positive, and certainly that's why the next category is clean all high-touch surfaces every day. And think about all the things that you touch: light switches, phones, remote controls, door handles, countertops, pulled doors on drawers and cabinets, and there's just so many things that people touch every day, and just being proactive by going through and wiping all that stuff down every day is going to help reduce the chances of spreading that illness.
Yeah, we generally think of obsessive compulsive disorder as just that, a disorder. But under this circumstance, it's almost as if we need to adopt a little piece of what people are doing and really trying to keep our environments clean and very well sanitized under these circumstances. And this is another thing I think you could enlist the person with intellectual disability in. A lot of people they can do this cleaning stuff. And, if it becomes part of their responsibility, I think that just increases their participation, increases the extent to which they feel like they're helping with this community problem. And to the extent I say feel like they're helping, they are helping with this community issue that we're dealing with. So I think that's very much something that you can bring people with disabilities into and make them a part of what we're all trying to accomplish together.
One of the comments here is to clean and disinfect areas that may have blood, stool, or body fluids on them. And the thing that just jumps right out at me is direct support staff caring for individuals in the home, and maybe they're having to change the bed linens and all this kind of stuff. Be mindful when you're picking that up, not to hold it up against you. I know most people are pretty good to hold it away from their body when they're carrying it out of the room or something like that. But just be mindful that you don't want to transfer the virus to your clothes and take it home to your family. So be mindful of the things that you're touching and the things that you're holding and assisting with in cleaning up people and that type of thing. And be sure to wipe everything down well if you are having to change everything because of a funny.
Oh, makes perfect sense. Yep.
Oh, so monitoring systems, or symptoms, I should say. Ideally, hopefully if you're having symptoms, you're going to contact your practitioner and get some direction from that. But here again, these are all just the same basic recommendations that we've seen so far in the handout. It's call the doctor before going, wear a face mask if you can, and then follow the instructions from the healthcare provider.
Yeah.
If you have an emergency, call 911. But try not to just show up at the emergency room or at your doctor's office.
And the thing about it is we're thinking a lot about coronavirus. It doesn't mean that people might not have an emergency of a different type as well that they have to get met. Of course, there are a couple things I want to point out here. One is that all of the MCOs now have a telehealth service by which their primary care physicians can provide services to them. So it's not, unless it's an emergency, there's no need to have to go to a doctor's office to get the service. You can get that service through telehealth. Regular appointments can be done in that manner. So that is something that has been made available that TennCare has supported, and so that is already available through all of the MCOs currently. The other thing that we have been talking with the MCOs about is the availability of a service called Station MD, and I had mentioned that on Monday we were going to have Dr. Matt Kaufman as our guest. Dr. Kaufman is the director of Station MD, which is a telehealth service designed specifically for people with intellectual and developmental disabilities. And we're hopeful of being able to make this service available to people within our systems. And what this service will add to what is already available is to have telehealth services at times when your physician may not be available, and to be able to divert a great number of those concerns away from emergency rooms. And that becomes of particular importance now because emergency rooms are going to be places where people who are positive for COVID-19 are going to be. And so to the extent that we can avoid emergency room visits, that is going to be a major plus, and we're hopeful of being able to make Station MD available to people to prevent that. We're still having some discussions about that, so we'll have to see where all that goes, but that is the hope. And on Monday, again, I'm going to have Dr. Kaufman come on and explain more about the service and to show more about how it can be really helpful to people with IBD across our state.
Thanks, Dr. Davis. So obviously you can see this is not an all-inclusive list of everything that you may encounter taking care of someone that's positive, but all the basic theories apply: hand washing, disinfecting, distancing, cough etiquette. Everything applies still in the home just as much as it would out in the public, and that just would help keep you, if you're caring for a person, that would help keep you from getting it or help spreading it to other people in the home. Certainly it apparently is very easily transmittable, and would not. Like I said, the whole point was to not get sick if you can. That would be the ideal. So what are going to be some of the guidelines to do if you've been sick, and so when can you resume your normal activities with other people? And, well, I guess as long as the virus is still going on, we're still going to maintain social distancing and probably staying at home unless we're going to medical treatments. But the guidelines do say if you've not had a test to determine if you're positive, and it says you can leave home after these things. 3 things have happened. You've had no fever for at least 72 hours. That's 3 full days of no fever without the use of medication to reduce fever. And your other symptoms have improved. For example, when you cough or shortness of breath have improved. And then at least 7 days have passed since your symptoms first appeared. So that at least gives us a little guideline to follow. It's not the 14 days thing like we've heard about so much in the quarantine and everything, but I'd have to say this must be appropriate if the CDC is putting it on their website for this is the guidelines to follow for if you've just had mild symptoms but have not been tested and don't know for sure. They've got it. If you've been tested, it says when your other symptoms have improved, like the shortness of breath, you receive 2 negative tests in a row, 24 hours apart. And I was thinking about this. This is really just in all cases there at the bottom. Follow the guidelines of your healthcare provider in the local health department as to what if you've been positive and they've done tests on you, you're likely being treated by them. At least some of the folks we support would likely be actively treated by them. So they'll help determine when that time is appropriate for you to.
Hey, David, somebody just brought up a really great point on the chat line that I thought I would throw in, and this goes back to masks. Again, I think there's a lot of interest in masks, but one of the things you might want to consider is preserving some of your resources for the circumstance where someone actually has an infection and where you're able to supply that. But the most effective part of that is supplying a mask to the person who has a COVID-19 virus, has the virus. And so in those cases, you want to make sure that you have a supply maybe that you've held in reserve for that purpose. And in fact, my information thus far is that it really is, there's not a great value in wearing the mask when you're not in that situation, when people do not have the illness. But is that consistent with the information you have here?
Absolutely.
Yeah.
The other section of this information that I have here was what to do if you yourself were sick. Was the guidance from that, and much of it's the same thing. It's avoid close contact, keep your hands clean, avoid touching your face, clean, disinfect in your home well, avoid crowds, and don't travel unless it's necessary. If you're sick, stay home, cover and cough, wear a face mask when you're sick, clean and disinfect. And so here are the basic symptoms. If you haven't heard it on the news, it's fever, cough, shortness of breath. Some people may not present with these symptoms, and they still could be contagious. So if there's any indication that somebody's been exposed or somebody could be positive,
I've seen fatigue. Yeah. I've seen fatigue added to that list in some more recent communications data. And it's not hard to figure out why, because probably the fatigue is somewhat secondary to the fact that maybe if people are experiencing a a fever or shortness of breath, that they're going to also experience fatigue at some point. So just something else to bring people's attention with that.
And then certainly any emergency warning signs that you might need care immediately would be difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, or blue lips or face.
So the blue lips, that's, what we're experiencing here is a difficulty supplying the oxygen to the lungs. I mean, essentially, right? So you are basically not breathing well.
Right.
And that's causing those other symptoms to occur.
Absolutely. Michelle, is there anything from the chat group that we want to specifically address, or if anybody's on the line that wants to come on and have a comment or a question or
so someone asked if this material is going to be sent out, so I had just shared the links where you had pulled it from, the CDC.
Okay.
But I haven't seen any questions, just a few comments about that.
Yeah, everything that we're doing is following the CDC guidance, and that is all available online. I will say there is a lot of it, and we have shared information. I think some of the information we've shared is specific guidance to home health agencies. We've also shared some guidance from long-term care facilities. I encourage everybody to go to those and review what's there to determine any specific things that you may want to develop policy-wise at your agency to protect against the virus. I think it's important that we retain the prospect of choice for the people that we serve. And yet at the same time, we also want to really make sure that they're aware of the risks of going into public settings at this point, and the need for all of us to contribute by isolating ourselves.
Well, I realize
the question came in here, David, from Candy again. She asked if pets have been infected. And so, what information do you have about pets?
Let me.
I think I'll go ahead and respond to this a little bit. I mean, the CDC is giving guidance that you should not get close to your pets in this circumstance. I think that there's a lot that's unknown about the extent to which pets may be carriers of this disorder. I think by and large we think that they are not, but I think out of an abundance of caution, people who are sick, the advice is they should not go close to pets or other animals. That was part of the guidance you gave just a little bit earlier.
Right.
So I can share a little bit on this. As of right now, the World Health Organization is saying that pets cannot contract the virus, but they can definitely be carriers just like any other surface or person can be. So that's kind of the reason for that guidance that's out there.
That's great.
I wanted to add just a little bit, these guidelines, although they need to be universally applied for all of us, for us in our homes and when we're taking care of people, this certainly isn't going to cover every situation that you're going to encounter taking care of folks.
David, I just got an email from Rhonda Alston questioning whether or not about glove use if you're caring for someone with COVID-19. Can you give us any guidelines on glove use?
Well, I would say that when you are working with the individual that is sick, you should be wearing gloves.
Yeah, I think that is a given that we should. And one of the important points that's been brought out to me. One of the standard precautions when we're wearing gloves is to remove them properly, so that you're not touching the surfaces that have touched other things. They're only helpful if you remove them and after use, and remove them properly by folding them inside of themselves and then discarding them appropriately.
Right, and if you've got the person like isolated in a bedroom or something, you need to remove those right as you're coming out of the room or in the room with a. I know some people can't have trash cans in their room because it might have pica or something like that. But removing those gloves as soon as you finish that contact with that person or in those surroundings, and washing your hands.
Yeah, that's one of the challenges in serving people with some people with IBD is people particularly who might require close care to be able to do self-care and other things of that nature, to do proper bathing or toileting or other things of that nature. And so, it's really, really important, I think, to minimize the amount of time that you're engaged in those activities when that has to happen, and to try your best really to help the person do as much of their own care as possible under those circumstances. But the reality is that there are going to be times where you have to get a little bit closer to be able to provide the care that someone needs, and just to keep all of the prevention measures in mind as you're doing that, and to sometimes take the best you can get closest to what you're supposed to be doing in a situation, because it's not always going to be ideal.
Exactly, because ideally the gowns would be appropriate for that also when you're in close contact with someone, but there just may not be a lot of isolation gowns available, for everyone to use, and even though we're healthcare providers as well as just as much as the nurses and the doctors and the first responders and such are, we just don't have a lot of access to every piece of protective equipment.
I think even people working in healthcare, in hospitals are having difficulty getting some of these.
This is one of the things that I stress with my son. He works at Kroger, and so I told him when you get home every day, as soon as you walk in the door, take your clothes off, put them in a laundry bag, separate from everything else, and so that you can wash those and go take a shower as soon as you get in the door. Anything that you've been carrying on yourself, from being exposed to anybody at work, you want to get that clean. Cleaning yourself is just as important as cleaning all the surfaces in your home. But yeah, changing those clothes, and for staff that are working and I recommend that too. If you're going home after work, have a dedicated place to take those clothes off and get them in the laundry and get them washed, so you're not spreading anything that you may be bringing from the home back to your family.
I just wanted to add, there's a question from the chat box. They want to know, once a person tests positive or does get the virus, does that make them immune to future events? Do we know that information yet?
We hope that, but I don't believe we know that yet.
Yeah. That's an unknown at this point, whether people actually get an immunity from having had it. And I've heard some discussion about reinfection as a possibility after people have had it already. So I think this is a pretty new phenomenon. So there are studies coming out daily about all of this. And as we get more information, we'll certainly be sharing that. But as of now, I don't think we know if this is something that you get an immunity from. While we're discussing all this, we have Dr. Victor Schuler on the line. I don't know if you have anything to add to anything we've been talking about, Dr. Schuler, but I'm happy to.
Before he does that, I just wanted to point out one thing that came in the chat. There are Relias trainings on how to put on and take off gloves, gowns, and other protective equipment. So someone put that in the chat, so I thought that was good information.
I'm really glad you brought that up. Yeah, Sharon Chambers made me aware of that a little bit earlier, and I intended to bring that up. So Relias does have training out there on several of these topics that we've been talking about.
What I would have to add is, first of all, that Relias information was great. I'd forgotten about that, so that's easily accessible for your staff. And having worn gloves for so many years in healthcare settings, you see so many people take them off wrong. and, or, they're thinking of themselves while they're wearing their gloves and they're protected, but not thinking about others who go around and will touch a doorknob, and thus expose others. But, my role is as a psychiatrist, and, I think it's important to keep all of our folks, behavior issues down as much as we can, because that's just going to complicate our tries at keeping people safe from infection. So, keeping them involved and making sure they're getting their medications, letting them know what's going on. I think that's a really important part of explaining the situation of why we're doing things differently. We're all going a little stir crazy. So if you have pre-existing mental illness, that's just going to make things worse.
Yeah, thank you. That's helpful advice. And, the point you made about gloves, because it doesn't necessarily protect others from you if you have a glove on. So you still have all the same things you would have had on your hand on that glove. And so somebody was asking the question about whether a person with COVID-19 should wear gloves, and actually I don't see how that offers any particular protection to others in that regard.
I agree.
Well, I had hoped that Patty Killingsworth was going to be able to join us, but I think she's tied up on a CMS call right now and was unable to join us. I did pass along what she had told me prior to our session today. So I'm disappointed that she wasn't able to come on and join us in person, but she certainly contributed by telling me about that prior to our broadcast today. Any other questions or discussion, comments out there? Well, we're going to continue to do this and try to provide updated information come on. Okay. Yes, jump in.
There's a question somewhere here that is asking about home mods being postponed, transitions. You might want to address that, because I think we have some of those answers. Because when will DIDD give some guidance? Can you see that one?
Yeah, well, so here's the clinical aspect of that we should be minimizing contact between people, okay? So home mods are going to require that somebody come into a home, going to require workers to come into a home. You're increasing the risk of exposure under that circumstance. I think that is, from a clinical perspective, I'm going to say that is something that should be delayed. And so we have had circumstances in some of our state homes where we were planning projects of that type. We have delayed those projects because of the risk of coronavirus infection. As it relates to transition, we have not totally stopped those. We've stopped the inspections because there again, we have someone coming into a space who an inspector who could infect someone or be infected by going into a setting. So we have suspended those. We have not suspended all transitions, and particularly we're maintaining the behavioral respite programs across the state. So those are going to continue to be available at least for now. We are conducting screening prior to people going into those settings, and that screening consists of the same questions that we would ask anybody if we were going to visit on an emergency basis. I think we put those questions out there before, Michelle. They might bear repeating. Do you have them readily available?
Yeah, so I put the link in the chat box. So DIDD has a COVID-19 section to the website now, which has all the information that's gone out in open line or any additional guidance that's gone out so that people can access it there. So for those of you calling in, if you go to tn.gov/DIDD, /COVID-19. That is where all of that information is.
Dr. Davis, you mentioned there a little bit about what we're doing in the state homes. That made me think of something also. We'll talk about visitors real quick. So.
Oh, yeah. Yeah, so we have ended visitation to our state ICF homes, and I know this creates an enormous emotional impact for conservatives, parents, others who want to visit, but under the circumstances of coronavirus, we have basically cut off all visitation during this period. Of course, these policies are under constant review, but at this time, we think that is the thing that we need to do to keep people safe. And I highly recommend the same approach within community settings. Of course, choice.
Something that is positive.
Yes, especially, well, in a circumstance where somebody's positive, you really have no choice under that circumstance but to limit the contact. But even for people who are not, that you want to limit that and offer alternatives such as doing FaceTime or something else, some other way that the person can have contact with their loved one without being in their same space is best. And, we were discussing other alternatives. If it comes right down to it, people could maintain the 6-foot distance. That's another key thing. So we want to maintain choice in this, but we also want to really, really have a policy of protecting people that we're providing services for.
I just want to say we've had a few other questions in the chat about what our policy is for things like supervising LPN supervisors and med monitoring and how to handle fire drills. I am documenting all of this information in case we want to put out additional guidance on it, just so that I can send it to you afterwards, Bruce. I don't know if you want to try to answer any of that.
David can respond to that.
I sent out an email that I sent to the regional nursing directors that should have filtered out through everyone regarding the RN face-to-face visits for the purpose of healthcare oversight. Certainly with the risk that there are that follows DID guidelines of doing electronic visits or phone calls any way that is appropriate for doing that oversight of those people receiving medical residential services. Same too would apply for LPN supervision. Certainly a FaceTime would be, you could observe someone performing a procedure to provide oversight for that if you need to, but there's other ways that you can provide oversight without making a personal visit on site.
And wherever you have those options, you need to do that. I mean, I just feel very strongly that you need to make those adaptations and to do that and to not feel constrained by some of the ways that we ordinarily have to do business, which is, where we require different things about people, being face-to-face or whatever. We're suspending a lot of that at this point. And so I want people to really, really be careful about being in the presence of others in these circumstances and to adapt what they do. Someone asked about fire drills. I don't know how to respond to that exactly, except to say that if the fire drill is going to increase exposure, I might seek some approval from a governing body to not do that under this circumstance. I might be thinking, I'm wondering if people are thinking that if you're in a congregate setting that you might do that, but I think we should be not in congregate settings at this point. And so doing those fire drills shouldn't be a possibility.
Yeah, I would think fire drills, as long as you could maintain social distancing and wasn't increasing your risk, would be fine.
That'd be the key.
Yeah, it's Victor. Our department, Ms. Kamari is doing a good job putting everything together in Open Line, which gets updated every day. So I'd really like to encourage everybody to look at Open Line daily because things change. In addition, there is an email out there where you can make comments and ask questions. which goes to the department, and then Ms. Kamari sends them out to the appropriate people. So that email address should be an open line also.
And if there's any nursing-related questions, certainly you can send them to the local regional nurses, or the regional directors, or you can feel free to send them to me.
Well, thank you, everybody. We really appreciate you being here today. This has been yet another great session of the Clinical Consultation Network. We get great questions, great contributions from our audience. We're really appreciative of that, and we're going to continue to stick with you through this process as we get through to the other side, which I know we will do at some point, and we will be better, I think, for the experience. It's one of those character building things, I think, that we're going through right now. And so I want to encourage everybody and to know that DIDD is here to support you in every way that we can. As David said, we're here for information. We're here to provide assistance, to make adjustments wherever we need to try to help. So thank you all, and we will see you again on Monday for the Clinical Consultation Network, Monday, 12:30 Central. We're going to have Dr. Matt Kaufman coming on to talk about Station MD and telehealth. So please be there for that. Thank you all.
Thanks, Dr. Davis.